Whiteout lung. In this session, we are going to learn to interpret complete whiteout of hemithorax. The common causes of whiteout of hemithorax include massive pleural effusion, total lung collapse, large consolidation, and pneumonectomy. Keep in mind all these four causes, and in the upcoming x-rays we'll discuss the features of each of the following causes. So whenever you encounter a whiteout of hemithorax, you should have a stepwise approach. So when a hemithorax is completely white, the first thing that you need to do is to determine the position of trachea. So you have to determine the position of trachea, whether the trachea is central, whether the trachea is shifted to the same side, ipsilateral side, or is it shifted to the opposite side or the contralateral side. Based on these features, we can make a diagnosis. If the trachea is shifted to the ipsilateral side, then it can mean either collapse or pneumonectomy. In both of these conditions, the volume is reduced, so the trachea is pulled to the same side. Then if the trachea is in midline, then it can indicate consolidation. If the trachea is shifted to the opposite side, then it means there is a massive effusion. In this first x-ray, you can see the left lung. There is a complete white out of the left lung. So this is what we meant by whiteout of the hemithorax. So here it's all white, so we are not seeing any lung. Now, as I said previously, the stepwise approach, first look for the trachea. So where is the trachea? So trachea is here, and it is moving in this direction. It is moving in the contralateral side. It is shifted to the contralateral side. This is the trachea. This dark one is the trachea. So it's clearly shifted to the opposite side. So what about the cardiac shadow? So this is the left side of the lung. So the cardiac shadow is supposed to be somewhere here, right? But then you are finding it is grossly shifted to this side. So this cardiac shadow is a marker for the mediastinal shift. So the cardiac shadow is shifted up here to the contralateral side. So whiteout with shift of trachea to the opposite side and the mediastinum to the opposite side, the first differential diagnosis is a massive effusion. It's a massive effusion. You can also see an ICD that has been put on the, maybe this X-ray was taken immediately after putting the ICD. In this X-ray, again, you're seeing a complete whiteout. This is what the typical whiteout that we discussed. I said initially, this is the whiteout of the hemithorax, whiteout of left hemithorax, and then you have a normal lung here. If you see the trachea slightly shifted to the right side, and then the mediastinum is also shifted to the opposite side. So this again indicates a massive effusion. This lung, you can see a whiteout, partially whiteout, a little bit of lung is left. So here you can see this air bronchogram. This air bronchogram is the dark branching bronchi in a background of white parenchyma. So there's consolidation in the parenchyma, and this bronchi, air is in the bronchi, so it looks like dark. You can see the structure here. So air bronchogram. So one of the causes of air bronchogram is a consolidation. So during consolidation, what happens is that the alveoli are filled with fluid, debris, the bacteria, macrophages, and all these things. So the entire alveoli will be devoid of air. When it is devoid of air, it becomes white. But the airway, that is supplying airway, are patent and they have air. So this air looks dark in the background of the white surface. So here it's a whiteout, like at least a partial whiteout, and you can see the air bronchogram. So this indicates a consolidation. Patient is intubated. So you can see the ET tube. This is the central line. So we couldn't assess the position of trachea in this case because he's on the ET tube is there and ventilatory support. But normally when there is a consolidation, we don't expect any change in the tracheal position. So in consolidation, trachea is expected to be in the center. So it's a severe pneumonia with the severe respiratory failure, so hence he is on ventilatory support. So again, see this thing, this partially white out, and again you can see it's not we saw this earlier in the pleural effusion. It was like complete white color sort of thing. So in consolidation you don't get that sort of thing. So here there is a background whiteout, but you can see this air bronchi. This is the air bronchogram. You can see that airway is filled with air and it is branching. So it is a air bronchogram. Again, this is a consolidation. Here there is a complete whiteout. It's a complete whiteout of the left lung. Now look at the trachea. This trachea is here slightly shifted to the left side. Slight on the left side. And if you see the opposite lung, so normally the cardiac shadow will come somewhere up here, crossing the midline and spine, and it's the end. But here you see the lungs has reached to the spinal area, so the cardiac shadow has been shifted up here, right? So based on these findings, most likely there is a total lung collapse here. If you can see the rib spaces not markedly reduced, but maybe subtly reduced. So here whiteout with the shift of the trachea and mediastinum to the same side indicates collapse. So here it looks like whiteout sort of thing in this hemithorax. Little bit air pockets are there. This lung, left lung, is hyperinflated, right? Trachea is shifted to the same side. This side we are talking about whiteout. This shifted to the same side. So there is a volume reduction here, right? Volume reduction here, and so trachea is pulled to the same side. So can this be effusion? No, it can't be effusion, because in effusion the trachea will be shifted to the opposite side and the mediastinum should be shifted to the opposite side. So this is the left side. So left side, usually heart shadow will come somewhere here, right? With the apex here, it should be here, but all these things have been shifted to this side, and there is volume reduction here. So the trachea is shifted to the same side. This cardiac shadow is also shifted to the same side. So, and you see some pockets of air up here, so it is most likely a fibrosis and cavity that has resulted in this kind of whiteout like picture. This is an interesting X-ray. Here there is a left whiteout and there is volume reduction. Why I am saying volume reduction? This diaphragm is elevated. So see the diaphragm here, and you can see the diaphragm here. Diaphragm is elevated here, and then you see this right lung is hyperinflated. Why hyperinflation? Because normally cardiac shadow will right heart button will come somewhere here, but so we are finding it lung till this area. And you can see this trachea here, and it goes to the right main bronchus is here, and left main bronchus only the stump is seen. So here we have a whiteout with volume loss. So we know the history, so it is a post-pneumonectomy chest x-ray. So in post-pneumonectomy chest x-ray, after this lung is removed surgically, the area that is empty is filled with the serous fluid. So initially it is up to this level, and as it becomes month on month, it keeps on increasing, and by the time it is like 4 to 6 months, the entire space is filled with the serous fluid. And so when x-rays are taken, then it looks like a whiteout, and here there is a hyperinflated lung, and the stump can also be seen, and the diaphragm will be elevated because there is a volume loss. We have removed the lung. So this is a post-pneumonectomy X-ray. Now the right side, whiteout, looking very clean, right? No air bronchogram, no patchy consolidations, full white, clear, whiteout. And then you see the trachea, it is shifted here, somewhere here, right? And the mediastinum, this cardiac shadow is shifted. If you see the rib spaces, it's subtly, there is a subtle increase in rib spaces compared to this side, right? So again, this is a massive effusion. Because of the effusion, it has pushed the trachea to the opposite side, mediastinum to the opposite side, and the rib spaces are enlarged. When you compare rib spaces, you have to compare the corresponding rib spaces. So here you see this is the rib space, and then you see the rib space. You can see that there is subtle increase in rib space in this right side compared to the left side. So this diagnosis is here is a massive effusion. This X-ray is a bit tricky. Here is some moss lesion, and this lung is kind of compressed here, and there is also an effusion up here. So it is multiple pathologies, and so it looks like a whiteout, not complete whiteout, partially whiteout. Lung is up here, so sometimes you can encounter similar kind of features as well. So this looks like a bilateral whiteout, right? Bilateral, it's a significant thing. So what can this be? It can be an ARDS, it can be a severe pneumonia, viral pneumonia, or it can be a pulmonary edema. So just based on X-ray, we may not be able to tell, but this pulmonary parenchyma is severely affected, and most likely patient is in a very critical state. When seeing the X-ray, it seems like that. So conclusion, whenever you see a white out of a hemithorax, the next step that you need to see is the trachea. If the trachea is central, then it can be a consolidation. If the trachea is shifted to the opposite side, then it can be a massive effusion. If the trachea is shifted to the same side, then it can be either a collapse or a pneumonectomy. This you have to be very clear, right? So whiteout, always look for the tracheal position. So the cumulative learning, in the first session, I advised you to always check the CP angle in every X-ray that you see. In the second session, I advised you to compare the lung volumes in every X-ray that you see. In the third session, I said never miss a straight line. It can indicate either hydropneumothorax or fluid in a cavity. In the fourth session, I said never miss a pneumothorax. And now I'm saying that always check the tracheal position in cases of whiteout of hemithorax. Thank you.